along with Barbie and Vanessa, I chair this group. So I missed one meeting because I was ill, and then another meeting I was traveling, so I kind of joined on my iPad. So it's been a while. So I don't know if we want to go ahead and do introductions or just kind of step into the Heads Up Act. What are the thoughts? Do you want to do introductions?
Up to you, Ellen.
Okay. Well, I think I know most of the people. There's a few new names, so I guess I'll skip over that. And I'm going to, Dr. Perlman, if you don't mind, do you want to give the background on the Heads Up Act? I think you're the best person to do it.
Yeah, I'd be happy to. Thanks. I'm a last minute fill in for Barbie. She called me into it. So I think that she said, so Vanessa and I, and Matt Holder and Rick Rader, we just wrote an article and submitted to Helen about Helen Journal about the Heads Up Act. So I wanted to do the article just so people could understand the history of it and where it's going and stuff like that. So we've been working on this medically underserved population issue since 2004. It's hard to believe when Matt Holder wanted loan repayment when he graduated med school and realized that the MUP status wasn't given to people with intellectual disabilities. So it's been a long, hard road, and I can give you a real recent update because number one, the congressman who introduced the bill, Seth Moulton, is my congressman in my district. And I actually cornered him the other day in the gym because we work out at the same place. And I hammered him about it because this bill is really kind of dead in the water. It's never been scored. It's not advancing. We're getting pushback from way too many people, but that's not to say. So I really hammered him about it. And the problem is that I've learned in the last 20 years to try and get things done. And if it's not his number one or number two item agenda, they don't really care as much. They do things, politicians do things for personal reasons and different things. So I hammered him. I said to him that the bill is too big. It's not going anywhere. You either have to give it up, move it to somebody else, or because it's not even on your top. They interviewed you recently in the newspaper, and it wasn't even in your top 10 item of what you want to do. So he apologized to me and he has a new staffer on health who's been very, very receptive. So we're moving ahead. So, the problem with the Heads Up Act is it's so broad and so big and so expensive. And not only that, we're getting extreme pushback from our own colleagues within the National Medical, National Dental, Hispanic. Our own people don't even want to support it. So that's a key factor. But it's not to say that we don't give up the fight, because as a result of the struggles with the Heads Up Act, Casey came out with his bill. You guys reviewed Bill 1219 that Senator Casey has, which is a Senate bill, which has a much better chance of passing. And it's the to amend the Public Health Service Act to provide health equity for people with disabilities. So things can, the good news on all this stuff is that we've never ever been working as close with the National Council on Disability. The National Council on Disability totally gets dentistry. As a matter of fact, the change of the code of ethics of the dental profession by adding that word disability in the code of ethics 2 years ago, that was 100% AADMD and National Council on Disability. We guided the National Council, but the National Council made the ADA change the code of ethics. And hopefully, with the guidance of both the National Council and the president, and our friend is now Biden appointed Jim Brett, head of the President's Committee for People with Disabilities, Intellectual Disabilities. So we've never had as close contact with two major government agencies that can help us move it. So I think the article that you all have about the history of the Heads Up Act, the frustrations and where we are now, will help because you have to understand the past before you can go to the future. So this Casey bill is a result of the Heads Up Act, and we don't know what other things can spin off it. Okay. We do know that we have two champions now. Used to be Harkin in the Senate. Now we have Casey in the Senate and Kathy McMorris Rogers in the House. And the good news is that, as you all know, health is in energy and commerce. And that's what Kathy McManus Rogers is, the head of the commerce. So, and we're looking forward to having personal meetings. We met with Casey already, but with Kathy, we're looking to set up personal meetings with her. So it's a struggle, but Moulton knows now that we're on his case too, and we're not going to just let him kick the can down the road, that he's actually got to help push this. He has a brand new staffer. She's done everything that we've asked possibly, including reviewing the article that you have. So it's with his blessing that we wrote that we have that article summarizing the Heads Up Act. So I hope, Barbie asked me to sit at the last minute. I hope that I'm here to answer any questions and lobby day. So from the legal guys at the National Council on Disabilities said, yes, go ahead with lobby, go do all this stuff. We realize it's a tough thing to build, but you never know what's happening. And, the actual disability law in Congress was actually passed on a fluke because there was no chance that was going to get anywhere. But, so anything, anybody, and we'd love to have help on it too.
So just to back up a little bit, the Heads Up Act is one of the three things that is the focus of the Hill Days for Open. So there's going to be a prep session for that on Monday at 3 p.m. But we wanted to talk through it a little bit from this because it really came out of this NRT sponsoring that, kind of wanting to be that part of Hill Day. So I have a PowerPoint that Vanessa put together that I can kind of share that kind of goes through the little more detail about what the Heads Up Act is, if anyone needs that detail. I'm not sure how much we've talked about it because I've missed a couple meetings. So let me know what you need.
I wonder if I could ask a question though, Steve.
Yeah, sure,
yeah.
Paul.
Hey, Steve, nice to see you. It's been a while. I'm curious about the opposition. What's the opposition? Is it money, that it would cost money? Is it like, why this group and not my other favorite group? Or what's the opposition about?
Okay, why is because the opposition is, the opposition comes within because designate part, a large part of the bill of the Heads Up Act is designating people with intellectual disabilities a medically underserved population. Okay.
Right, got that.
So we thought that it would work because it's no money. I mean, we're not asking the government to put any money into this program. It's splitting the pie. And the opposition comes from the people that are getting the pie. They absolutely will not support it. And then if the government gives people without, there was when Matt discovered this problem and we started on a journey, right? We realized that there was a simple thing. It was only 4 criteria that HRSA had, 4 criteria. It was morbidity, mortality, access to primary care physicians, and poverty level. That's it. It was 4 things, and you scored those 4 things. In 2004, it was only African Americans, Hispanics, and Native Americans in zip coded areas. Okay, when we showed the government that we were below those actual scores, the government changed the formula and never came up with a new formula. So it's too vague now. So that they can't geographically locate people with disabilities. They live in group homes, they live with their parents. But the big problem, honestly, is the pushback from within the national so the ADA passed it, the AMA passed it in 2010. First round, the ADA actually screwed around with me. It took them 4 years after the AMA passed it to pass the the MUP, to designating, endorsing people with intellectual disabilities, medically underserved population. But the problem is that if they give it to people with intellectual disabilities, which are only 7.5 to 10 million, the big D wants it. And then they're afraid Down syndrome, cerebral palsy. So those are the big obstacles. But we still got to march on because, like I said, the health equity came out of this failure. So we were told now, just this week, the National Council on Disabilities said, pick 3 things. And I'd love to have the feedback from everybody in this room, because we think that one of the things would be loan repayment. Does everybody agree? Loan repayment would be, if people could get loan repayment to work at Paul, one of your facilities, one of your developmental centers, Tufts facility for the handicapped, whatever it is, if they could get loan repayment, because see, the MUP status automatically gives loan repayment. If we can't get the MUP status, what are our 3 asks? We're thinking loan repayment would be one. Help me with the other 2.
But doesn't loan repayment cost money? In other words, if this was designated, I'm totally for it, but if this was designated and then people with a designated facility could get loan repayment, wouldn't that add to the amount of money that the government spends on loan repayment?
Yeah, but that doesn't seem to bother them as much as, no, it would probably come out of, I think it's a good question, but everybody, even Casey's office said that's doable for us. But
Okay.
Again, loan repayment only for ID.
Yeah.
Not opening it up to anybody else, just ID.
Yeah, so, and in the focus on the Heads Up Act, we've limited it to people with IDD, not all people with disabilities.
Right. That's going to be the killer. There's no way the government is going to designate 52 million people with a medically underserved population. And even we're fighting about the numbers too, because, historically, everybody says 7.5 million. But May Pham, in her Institute of Exceptional Care, she claims 10, and she's really done a lot of research on this, 10 to 12. But do you know that children under 5, the government only counts blind and deaf in the number? There's only 155,000 kids under the age of 5, according with disabilities. That's a real difficult to fix, because we've been working on the CDC with this. It's the Census Bureau that counts that. So then we're tackling the Census Bureau to change the definition of what they're looking for.
Because they won't, I think the reasoning is that they don't know people who have disabilities and people who have delays, but anyone that works in this profession knows that, some people have disabilities from birth that aren't going to change. They aren't going to grow out of them, so to speak.
You know that there's a hell of a lot more than 155,000 kids under the age of 5 with a disability. That number is ridiculous.
Yeah, because they're just counting people who are blind and deaf, like you said. They're not counting anyone with any kind of other intellectual or developmental disability. So, okay, any more questions? Do you have more questions, Dr. Glassman?
No, that was very helpful. Thanks, Steve.
Yeah, Paul, what other things would you shoot for?
I don't know. I mean, the thing you said a minute ago is what I've heard for as long as this has been talked about for, probably a decade or more, which is that there is a tendency for people to say, why that group and why not my group? And are you going to take something away from me? Are we going to lose out if that goes forward? That's the argument I've been hearing for a long time. And that's a tough one. I don't know how you keep people from being in opposition. That's what I was, thinking about.
You can't. And no matter what we've shot, we've sent them countless articles on how many African-American kids there are with disabilities, how many Hispanic kids there are with disabilities. Then it's a non-issue. It's a non-issue with them. So it's a tough road.
Well, I guess one question, as you said, it's not, other than maybe a little bit of money for loan repayment, it's not a matter of adding to the pie, it's slicing it differently, but slicing it differently means some people feel like their slices of the pie are getting smaller. Is there a way to do this so it doesn't do that, so it actually expands the pie? I don't know enough about the intricacies of the mechanism to know, could you remove that opposition by expanding the pie rather than dividing it up differently?
well, expanding the pie would be asking for an appropriation of money, and nobody seems to think that's going to work.
Got it. Yeah, I got it. Got it.
So they're really looking for three things, one of which is loan repayment. But
That's our idea. First, we thought loan repayment was a doable thing, and everybody gets it. And so that would be one of the and they bought it in our conversations off the cuff with the attorneys and everything, and say, yeah, loan repayment. Who could, encouraging physicians, dentists, nurses, anybody in the healthcare of speech and language, OTPT, encouraging healthcare professionals to go into that community. Who could dispute that for an ask?
What does it actually mean? Because we're not talking about people in a geographic community. So what do you mean when you say someone would go into that community? How would the mechanism work?
Like probably you like, why not your developmental, your regional center model in California?
Well, if there's a physical place for like residential facilities or something like that, but the minority of people actually are living in institutional settings, so that something, but not a huge solution.
I think you know what it is. It's a certain percentage of your practice. You have to show that in your private practice that you're doing a percentage, which has to be figured out. That's how it's going to be, because we know that the model now is inclusive care in the community.
Right.
We don't want parents, caregivers now. They don't want to go to a center. They want to go to the guy on the corner. They want to go on a private practice. That's the model. We know. It's funny when we started on this journey. If we said anything, Paul, you and I go back forever, right? So we started on the journey. It was like, if the social model people say, if you even mention the word institution or have anything to do with an institution, we don't want anything for you. And we would say, that's where we learned we learned to be experts by working in those places. Where do I use the Rick Rader thing. Why did Willie Sutton rob banks? Because that's where the money is. Why do we train people? Why did we train people in those facilities? Because that's where the people, would you rather have them go to school and see one patient a month, or would you rather have them see 20 patients a day to learn their skills? But that model is gone. It's got to be back in the community. So the designation would be for a private practitioner. It would be that documentation that X amount of time of his practice is treating people with disabilities. And that's how we want them to figure it out.
Yeah, that makes sense.
They could do that by Medicaid coding or billing, whatever it is.
so is there what are the other types of things that can be included?
Well, it's up to us to come up with the asks.
Okay.
So there's a couple things in the chat from Eve. She's saying, how about increasing payment for care for patients with disability related diagnostic codes? I don't know if you want to riff on that one, and the other one is, how about teaching oral health prevention to the medically underserved and preventing 85% of disease? That's an excellent statistic there.
I think you covered my question.
Yeah, both of those were yours.
Well, I could just add something about the idea of increased payments, because there are several states where, now this is a state decision, so we'd have to think about what the federal ask is, but there are several states where they do have either a higher rate for people who are designated in certain categories, like people with disabilities, or they have a payment for extra time that it takes to work with someone. Now, those can be a little complicated and require lots of documentation, but for instance, California does have a payable code in the Medicaid dental program for extra time that it takes to work with someone with a disability. So that, I'm not sure quite how you do that at the federal level. At the state level, that's something that's happening in a few states, but maybe there's some way to build that into federal programs, that it could be some federal flexibility that extends down to the states and encourages states to adopt that. Just a thought.
So I mean, money, increased reimbursement is really important. We know that that's one of the huge barriers is lack, inadequate reimbursement. But when you go to the legislators and you say, and then because I've gone to people like the Kennedy Foundation, they say, "Brahma, what do you mean? Dentists don't make enough? You guys make more than any other profession now. You want us to pay you more to treat people that you should be treating in the first place?" So I just walked just walked with my cardiologist who gets less money for putting in a pacemaker than somebody for doing like a stupid dental procedure yes, we know that more money, but that's not we know that it's much deeper. It's stigma. It's there's 20 different reasons why they don't treat people with disabilities, but money is tough to sell because any person who just went to the dentist and paid $12,000 for a couple of crowns and an implant doesn't feel sorry for you in the profession for spending a few more minutes treating somebody with a disability. That's it's a tough sell, but it's an important sell.
Yeah, no, it's true.
This is Alan. The AADMD, we have three subgroups that are working on it. One of what you're talking about, Paul, is can we create a standardized coverage for all patients with people with ID throughout all states? And so we're working with that in a coalition, utilizing some of the models that are out there, including the Delta Dental Midwest model, and increasing frequency and visits, as well as increasing all the coverages for adult care as well. So we're trying to coalition with physicians and groups and whatnot. So we're moving in that direction, try to standardize it so that all patients with IDD in any state have a universal type coverage.
And for dental?
For dental, right? Dental, oral health, and medical as well.
Okay. So that sounds good.
Right. And the advocacy group for AADMD, we're really working off of that National Council on Disabilities 3 recommendations. One is to standardize the definition for intellectual disability, because in the federal government, there's like over 80 different definitions that kind of can conflict with one another. So we've gone together with Mary Foley, of course, that you all do know probably from MISDA, and trying to standardize the definition that all the organizations can agree upon. The second thing was to increase the second recommendation for the National Council, which is to make sure that adults with ID get coverage past their certain age. And the third big thing is to create a new pie, a new funding source for a new program that would be different. Instead of trying to retrofit things, is to create something that would make sense from beginning to end. So that's what we're doing at AADMD.
That sounds great. So was it Amy Sanchez are you the AS that was talking about Senator Sanders' plans?
Yeah, this is Amy Sanchez. I'm with CareQuest Institute for Oral Health. I helped put together the background for the Heads Up Act based on the information that we got from staffers and from organizations that will be used for Hill Day, and that I think was included as part of background for that article. We had a really good conversation with Senator Sanders' staff, and then Nancy and Vanessa with Achieva had a really good conversation with Senator Casey's staff about their plans. I know Senator Sanders, who's chairman of the Senate Help Committee, has already announced a series of markups. The most recent of one he announced, I think, that before they, I guess after they came back from the 4th, that recess. And so I don't know if he's included this one already, but Senator Casey's bill was supposedly going to be included in one of those markups.
Thank you, Amy. That's helpful. And I think the next thing on the agenda was there was conversation about as we set up the Hill Day meetings, wherever we have meetings with, or I guess whichever reps and senators we have meetings with, we want to include people with IDD that have been trained by Special Olympics in those meetings. So we just kind of need to coordinate that. And Dr. Perlman, you might have more detail on those individuals, and we just need some kind of mechanism to identify what meetings we have set up and where we need individuals from.
So, I don't know if you have it, but Barbie sent me just right now before this meeting that the targeted Senate specific members, do you if you want to disseminate that email to the group, I don't know if you had it already, but she's got the in the Senate Health Committee, the majority and minority. It's a 2-pager. I can make sure that I'll tell Barbie to circulate it through this group.
Yeah, we'll have it sent out. I don't know if it's been sent out yet, but I have it and we can send it out.
Okay, great.
But I think the Hill Day meetings might be, we can send that out in general. The Hill Day meetings might be dependent on who's registered for Hill Day, because they're connecting the people that are registered with their senators and reps. Is that correct, Francis?
Yes. So my understanding is that the Hill Day registration is closed. And then we're hoping to invite these self-advocates once we figure out like what are the meeting times with the senators on that list, and then being able to include the self-advocates despite not having registered.
Yes, that's what I was thinking.
confirmed.
Like, we would be, once we get the list of who the meetings are with and what time they are, we can share that with Dr. Hurlman and his network of people nationwide, and hopefully get self-advocates to those meetings. That was my understanding of how we were going to do it. Does that make sense? And of course, we can share it with this group. So if you have any self-advocates in your area that you want to be included, we can do that. But my understanding is the individuals that are involved in the Special Olympics have had advocacy training and are very articulate in speaking to the benefits and their needs and things like that.
Yeah, they do have a lot. So Barbie was dialoguing with them on that. So she'll can send an email to update.
Okay.
Okay.
And I had opened the agenda, but let me see. I lost it for a minute. And is there, what else is next on the agenda?
So on the coordination, sorry, Ellen, I didn't mean to cut up
Go ahead,
in there.
Amy.
I'm actually
Yeah.
chatting with Bianca right now. And so we are working with our lobbying firm, Tremont Services Group, to actually schedule these meetings, right? So we have a check-in call with them tomorrow. And I think they let Bianca, I think Barbie let Bianca know that this was happening. And so Bianca and Barbie are working on that kind of mechanism to integrate folks into those meetings as TSG is setting them up. So so I think those two folks have that covered.
Okay. Thank you. I just want to make people aware of it.
Yeah.
And the last thing on the agenda is, as we're going into these meetings, if you're all going to Hill Day, it's just bringing state specific data on people with IDD. And we have an example of that. Francis, I don't know if you sent this from Louisiana, because remember Louisiana is the state that got Medicaid dental for adults with IDD passed within their state. And so they had put together 1-pagers on the data. So it's the kind of data that we're looking for. I thought Kathy Dwyer was going to be on this call, unless she's just here as the iPhone. I don't see her on the call. But we can share. I don't know if you can pull that up, Francis, Louisiana 1-pagers.
Yes.
Good afternoon, everybody. This is Monica Roberts, and I'm with Louisiana Office for
Okay.
Citizens with Developmental Disabilities.
Yay!
My apologies. I'm driving, well, kind of en route right now.
Well,
But
and I
if you
didn't
need a
realize
copy
you
of
were
that
with
one-
Louisiana. I was looking for
Yes.
Kathy's name. I always remember
Yeah,
Kathy's name because I have an aunt, Kathy Dwyer, so it sticks in my head. So do you, I'll have Monica, I'm sorry, I'll have Francis share the document that you put together, but do you want to kind of go through the kind of data you shared with your legislature in order to get that passed, Monica?
Let's see. get my bearings together here. Basically, like I say, we looked at the need, the services that we currently have available, and let me see if I can get this together. And kind of focus on what the savings would be, of course, with the recurring visits to the ER, preventative measures, and so that the key was to focus on the financial gains. That was a biggie. And also we had folks within the legislation that had children or adult children with developmental disabilities. So we had somebody inside that was very beneficial in helping to push things through.
Mm-hmm. Great. So we can see like we're sharing Frances is sharing her screen. So we saw that there was a section on the emergency room use for dental, over dependence on emergency departments for addressing dental needs by people with developmental disabilities. And then the importance of prevention. And then on the second page, looking at the cost of routine preventative care.
And our Medicaid department was instrumental as well. We partnered with them to pull up the bulk of these figures. So it was a collaborative effort.
Okay, so that is.
So excuse me. Our biggest challenge right now is obtaining clinicians that are willing and able to provide the services and to accept Medicaid. So that's been the huge struggle right now. So what we're doing now as well is we've got the funding in order to provide trainings to our dental districts or our local dental associations through the various regions throughout the state. So that's been a way to expand the training on providing dental care for folks with IDD. And our Dr. Jacob Dent, he's had a program developed already. So we've been able to utilize and work with him. And the trainings have gone over very well. So we'll see what the outcome is with the increase in the capacity. And now we're working on providing the trainings for hygienists and just trying to define other entities that could benefit to help us again expand that capacity, because that's the huge challenge right now.
Absolutely.
This is Steve. I have a question. Did you, when you submitted this to the legislators, did you break down in this fact sheet the number of people with intellectual disabilities in each congressional district in Louisiana?
Steve, I can't answer that, but I can inquire and get that question answered for you. I'm not sure if it was broken down in the districts or just presented as a whole and overall.
Because we believe that politics is local, and that it may be a little outdated, and I can get my hands on it because a couple of years ago. But Barry Waldman, a colleague in a sabbatical, broke down every congressional district in the country and how many people with intellectual disabilities were in each congressional district as a tool for everybody to use. Because, like I said, lobbying is better at the local level, works a lot.
Dr. Perlman, that would be awesome, because I think when we're meeting with representatives to be able to say there's 7.5 to 10 million people nationwide, but in this district, this affects, whatever it is, 100,000, 200,000, 50,000 people. It's really effective. And that's what we were kind of trying to get at with this example, is that you need to go into the Hill Day with knowing like how many people are in the district with intellectual and developmental disabilities. And if you can access data on utilization of dental or utilization data related to emergency room use for dental, that's really helpful to have that information from the district or from the state. So if you can track that down, that would be wonderful.
Okay. Yeah. Yeah, because the numbers, when you tell some of these legislators or their staff that, there are 10 million people with intellectual disabilities in the country. Yeah, these big numbers. But when it's like, oh, in your state, there are 422,000.
And to say, and this is one of them, this is my colleague from Special O, Sue Smith, that has a intellectual and developmental disability. That's even more powerful, which is why we want to get those advocates on the calls as well.
Right.
So any other kind of questions about data, bringing data to the Hill Day meetings?
This is Amy. So I know that the deadline for submitting materials to be included as part of the overall package of Hill Day things for Open's virtual Hill Day is tomorrow. But this looks amazing, and this is exactly the kind of data we need. So even if it's not included as part of the meetings, I wanted to offer that we will use our resources, whether it's through TSG or my relationships, to follow up with any of this staffers for any of the regions, their constituents. If you're bringing this kind of data, we will follow up with them by email after the fact and make sure that they know about the activity that happened during Hill Day and that they have this data.
And I was thinking more, Amy, that people would just kind of share verbally.
Yeah.
The data that they have. They wouldn't.
But this visual is amazing. Like Monica did an
Isn't it
amazing
great?
job. Yeah, this is, and the fact that Senator Cassidy is actually the ranking member of HELP. I mean, like that's kind of the perfect kind of demonstrative that we want to bring to these meetings. So, if others have things that look like this, we absolutely want to share it, even if it's not, as part of the official Hill Day material. So we can send that after the fact, not a problem.
Thank you, Amy. I appreciate that.
Yeah, totally.
I appreciate all your support. It has been amazing. Anything else on this issue? If there's not, I'm going to hand it over to Francis for some other open updates. But any other questions, comments? Okay, the last thing on the agenda is open updates from Francis. So I'm going to hand it over to you, Francis.
Thank you. I am actually, since I already have my screen open, I'm going to share with you all. These updates were posted on Open Communities the other day. And so this is the quick everything all upcoming. So the virtual Hill Day, as you all know, September 12th and 13th, those will be our big days all together. And so leading up to that, beginning on Monday, we have a series of workshops. So training about what are these messages, how can we best advocate to our members of Congress. So that begins Monday, the 21st. We also have Veterans Oral Health the following day. The federal funding for oral health will be next week on Thursday. And then successful meeting tips following on August 29th. We will be hosting the virtual annual meeting. And so that will be October 24th through the 26th. So registration will be following, I believe, by next week, hopefully. And then we also have the Open and CareQuest Institute for Oral Health Learning Community. And so we kicked off in June with the Jedi and Practices learning community. And now we'll have one coming up on August 30th about oral health policy and advocacy. So I feel like August, September is very advocacy heavy months for Open. So join us for all these opportunities. You can take a look at all the rest of the things in this list. There's a number of updates from the different network response teams and links, of course, to access all the great resources that are being shared and developed. So I'll pause there. I'll see if anybody has any questions or anything open related.
So, and as Francis said, the three issues that we're going to deal with at Hill Day are the Heads Up Act, support for veterans oral health, and funding for all the states, CDC funding for all the states, federal funding for all the states. So, and those she shared with you the prep meetings for all those. Okay, anything else? then I'll give you back 19 minutes of your day and see you on Monday at 3 p.m. for the prep session on the Heads Up Act. Thank you, Dr. Perlman, for stepping in for Barbie.
Oh, it's a pleasure. Good to see some old faces again. Thanks. Thank you for inviting me. Bye-bye.
Thank you.
Everybody.
Bye-bye.